All right, now on to a wild new smear campaign from the Democratic Party. They are now actually claiming that if passed, this big, beautiful budget bill of Donald Trump will kill scores of Americans. It's going to kill you. Remember, Republicans are racist, sexist, homophobic, xenophobic, Islamophobic. They want dirty air and water, and they want to kick grandma and grandpa over a cliff and kill them. Take a look.
We're all going to die, Bill. And that shows the callousness of this Republican majority in the House and the Republican majority in the Senate.
And the reality is, because of this House Republican bill, if it were to pass and become law, people will die.
Now, other top Democrats claiming that the bill would kill 51,000 people a year because of non-existent cuts to Medicaid. Non-existent. Here to respond, the Centers for Medicare, Medicaid Services, the administrator, Dr. Mehmet Oz, is with us. Dr. Oz, are there any such cuts in this bill? My reading of it is the only thing that would be cut are those people that don't belong on the rolls, that have given fraudulent information, that will be weeded out of services they never deserved in the first place. There's no cuts that I know of that exist in that bill.
In every scenario that I've seen, including the one that's in the current One Big Beautiful Bill, we are increasing Medicaid spending. And I'll give you a number. We project $200 billion of more money being spent on Medicaid. We already have a healthcare system that spends twice as much on individuals as any other system in the world. So the problem isn't money. The issue is the increased expenditures on Medicaid, which is 50% bigger than it was 5 years ago before the pandemic, is crippling the system. We are hurting Medicaid. The president said, and is very clear on this, he wants to love and cherish these programs. Our job is to save this system. Why? Because as you walk into our building at Healthy Human Services, where me and Bobby Kennedy and others reside, there's a great quote. It says, it's the moral obligation of government to take care of people at the dawn of their life, the children, those at the twilight of their life, elderly, and those living in the shadows, folks who have handicaps, who are disabled. That's the job, to make sure that original population that 60 years ago was envisioned to require Medicaid. Great people protect their vulnerable. We're going to do that. But if you're cowardly and not willing to make important changes to fix the system so it's viable for the next generation, then you're actually hamstringing it. So specifically, what does this bill do? Sean, it says you have to be able to either get a job or try to get a job, volunteer, get an education, just help out around the home by taking care of a relative. Do something that shows you have agency over your future. If you're not willing to do that, we're not going to give you Medicaid. I think most Americans would do that if they're offered the choice of free health insurance in return. I have confidence in the American people. The Democratic Party does not. They don't think Americans are going to do that. And I've got more news for you on this topic. Even the Democrats realize the system is so sick, they had to unwind COVID. That resulted over the last year and a half, in 15 million Americans coming off Medicaid. But it did not change dramatically the number of people uninsured. 90% of these people went on to the exchanges. They went on to commercial health insurance. They went to Medicare. They got other forms of coverage. So the system is resilient. We're doing what needs to be done to heal a bad infection to preserve the system. That's the president's charge to me.
Dr. Oz, the trajectory of growth the last 5 years has been very high. And I mean growth increases, massive increases in spending. Now, when Newt Gingrich partnered with Bill Clinton, they reduced the rate of growth to a whopping 7% a year, every year for 7 years. That resulted in a balanced budget. They had 5 balanced budgets in a row. We've not balanced the budget since. When they reduced the rate of growth instead of baseline budgeting, and they reduced it to 7% a year. That's a big increase. It was said at the time that old people were going to die and that they were cutting. They weren't cutting. They just reduced the increase from 12% to 7% so we could stop stealing from our kids. Is that similar here?
Similar scenario, Sean. We're asking for radical things like make sure you double check in Social Security that the patient didn't already die. So why would you pay health insurance for someone who's not alive anymore? They're asking for income verification. You can't just tell us what you made. We actually should be able to check that, and states should feel that obligation. We also have crises that have now led to 660,000 people having Medicaid in multiple states. That means the federal government's paying for people in multiple states for full health coverage, even though that's not really what's being done. Only one state is actually taking care of the patient. But I'll give you the biggest and most shameful issue for me, Sean. This wasn't true until the end of the Biden administration. Even the Obama administration prevented this. They banned individuals on Medicaid who were getting free health care insurance from getting health care benefits that were greater than those on Medicare who've been paying into the system. If you're on Medicare at home right now, guess what? The people on Medicaid in your state probably reimburse their doctors more than you do. I'll say that again. People on Medicaid are paying their doctors less, sometimes 1/3 what Medicaid patients in that same state are paying doctors. This isn't correct. It's not right. It's a moral failing. This bill protects now seniors to make sure they get to pay their doctors the same as Medicaid patients. Not a difference.
We need to
just the same.
rethink.
These are rational choices.
We need to rethink a lot of this. Healthcare savings accounts. We need telemedicine included, healthcare cooperatives, catastrophic care as part of an equation to lower costs. But
Sean,
we'll talk more about
one favor.
Yeah.
To interrupt you, it's my birthday, as you know. Today,
Happy birthday.
I got my Medicaid card. So I'm asking all Americans, please, if you're turning 65 like I am, and many of you are,
I got
check
time.
Medicaid,
I
go
got
to
time.
Medicare.gov. I've got my Medicare card. So I'm proudly a beneficiary of the program that I've been asked to run. So Medicare.gov, check it out.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.